Sorry for the delay. Hi. So, good evening, ladies and gentlemen. Let me start by thanking EVG Network and my upline for bringing the wonderful science of nutritional immunology into my life. My name is Charlie, your MC for tonight's medicine, supplements, and food webinar. And also a big welcome to all of you for joining us. So before we commence the presentation, do take note that all your microphone has been muted to prevent any disruption to the entire presentation. Also, you may use the chat function to interact with us throughout the presentation. We also have a Q&A segment towards the end of the webinar where you can raise your questions regarding tonight's presentation via the chat function, or you can unmute your microphone and voice out your question. Now, if you are using a mobile to view, you may maximize your reading experience by zooming in into the slide. So, medicines, supplements, and food. These three words, we hear them so often, but how much do we know about them? So let's start with medicines. Must we take medicines when we are feeling unwell? Can medicines cure diseases? How about supplements? Is it necessary to consume them? Does it come with any side effects? Does it strengthen our immune system? Now, how about food? What kind of foods is our body designed for? We know that plant foods are very beneficial to health, but can we consume them wholeheartedly without any concerns? Lastly, what are the foods that truly boost our immune system? With all these questions in mind, we have invited two speakers to share with us. So Cindy will cover medicines and supplements. Denise will share on foods. Now, let's put our hands together for Cindy and Denise.
A very good evening to everyone. I'm Cindy. In the 19th century, scientists observed that many women face life-threatening complications during childbirth, while doctors were still unaware of existence of bacteria. So let us understand about medicine first. In the 19th century, many women became seriously ill or even died shortly after childbirth. At that time, doctors did not know about bacteria. No effective drugs existed, and hand washing was not practiced during deliveries. As a result, bacterial infections were common and often fatal. This situation eventually led scientists to develop antibiotics. In 1928, the first antibiotic, penicillin, was discovered, and by 1942, it was officially put into use. This marked the beginning of the proper use of antibiotics in medicine. Antibiotics are designed to kill bacteria. In the US and other developed countries, patients are tested to confirm a bacterial infection before a doctor prescribes antibiotics. If doctor prescribes them incorrectly, they risk losing their medical license. However, this strict practice is not common in many Asian countries, including Singapore. As a result, antibiotics are often prescribed even when the patient does not have a bacterial infection. This misuse and overuse of antibiotics have led to a major problem: antibiotic resistance. Antibiotic resistance occurs when some bacteria survive treatment, continue to multiply, and eventually become resistant to the same drug. Over time, these resistant bacteria, often called superbugs, can cause infections that no longer respond to standard antibiotics. It is important to note that most illnesses are caused not by bacteria, but by viruses, which cannot be treated with antibiotics. Let's take a look at the common viruses we might have seen or heard before, like SARS, H1N1, influenza A, B, hepatitis B, HPV virus, meningitis, and foot-and-mouth disease, HIV, Ebola virus, dengue fever, Zika virus, and etc. Most of the viruses have a vaccine for it. Not all have a vaccine. So let's take a look how vaccines are formed. When a virus invades our body, the B cell in our body will start to react, producing antibodies to fight these bacteria, viruses, and pathogens. And these B cells have a memory function as well. When we were caught to the same viruses, bacteria against this memory B cell will be more efficient to destroy these viruses and bacteria. Vaccines are made using weakened bacteria or viruses to trigger our immune system to produce antibodies against them, which our body has the ability to fight future infection caused by the same strain viruses. There are so many viruses out there, and some do not have vaccine developed. As we can see that medical science is not able to catch up with the viruses mutation, thus it is the best to rely on our immune system, like our B cell, to do the job for us. Let's talk about drugs for autoimmune disease. Currently, there is no cure for autoimmune disease. Some autoimmune disease which are commonly seen are, example, rheumatoid arthritis, cirrhosis, lupus, and etc. Sometimes doctor may prescribe steroid to suppress the immune system to relieve the symptoms, but these steroids came with steroid side effect like increased severity of and vulnerability to infections, hence leading to increased risk of cancer, and then overall immunity will be weakened. Now let's look at the drugs for chronic diseases. Example, hypertension medications, cholesterol medications, diabetes medication, hormonal-related medication. All these are some of the chronic diseases, and this medication will only alleviate symptoms and needs to be taken for long term. If I do not take the medicine, the symptoms will come back again. Right now, there is no cure for these chronic diseases, and such medication are only treating the symptoms. Some common medication will be fever medication to reduce the fever and pain, but it may cause destructions of liver and kidney cells, hence leading to liver and kidney failure and some even brain damage. With fever medication, it is linked to about 450 deaths in the US every year, which is quite a lot. And the antibiotics, which I have mentioned earlier, is to kill bacteria and treat bacterial infection. But it can affect our immunity, and when misused, it can lead to bacterial resistance and some side effects like diarrhea, vomiting, and bad cases, allergic shock, and even death. Sedatives are drugs to induce sleep, but it comes with side effects as well. Example like short-term memory loss, breathing problems, and even addiction for resistance to medication after a month. Also, the common painkillers which help to relieve pain can also like peptic ulcers, slow wound healing, liver damage, and in severe it also affect the nervous system and difficulty breathing. So now modern medicine can be classified into two big categories, medicine and surgery. Drugs can save lives in times of emergency. However, if it's misused, it can also kill. So let's move on the supplement. So how do supplements come about? During the World War, there was famine outbreak due to the lack of food. Many people fell ill as they lacked basic nutrients for survival. The first supplements were to help these people to survive. The common vitamin pill found in the market, there are example vitamin A, C, D, and E. But do you know that this vitamin cause side effect as well? Vitamin A can cause fatigue, osteoporosis, birth defect, lung cancer. Vitamin C can cause kidney stone and cancer. Vitamin D can cause fast heartbeat, and vitamin E can cause osteoporosis and prostate cancer as well. So what about minerals from supplements that cause side effects as well? Example like calcium, very familiar to us. British Medical Journal, BMJ, they conducted a trial and result shows that 12,000 participants who took calcium have increased risk of myocardial infarctions, that is heart attack, by 30%. And also folic acid, which is essential in pregnant women, but there are side effects to it as well. Example like lung cancer, colorectal cancer, and prostate cancer. And then iron, also commonly found in pharmacies, can cause side effects like constipation, nausea, vomiting, diarrhea, cancer, cardiovascular disease. Overdose can even lead to death. Glucosamine, so we see many glucosamine supplement, right? And have you looked at the label on the bottle before? Many glucosamine sources are from animal cartilage. Example, bovine and shark. Shells of shellfish, example, crabs, lobster, and shrimp. And some made in the laboratory, example, using fermented corn as partial material. And actually, it also causes side effects like breathing difficulties and worsening asthma, which is very dangerous. And the toxin accumulated in the animals' bodies and their shells is harmful to the human body. It can also lead to insulin resistance and also increases the risk of developing diabetes. We also heard about omega-3 is good for us, right? But omega-3 fatty acid from animal sources like fish skin oil and cod liver oil supplements can actually increase the risk of cardiovascular diseases and also causing marine pollution. These supplements may interfere with the effects of anticoagulants, aspirin, and blood pressure medication, which is not what we want, right? Furthermore, it can also cause diarrhea and also not environmentally friendly. So what about probiotics? Probiotics from dietary supplements and in dairy products. Common bacteria added in these supplements are Lactobacillus, Acidophilus, and etc. This can cause serious allergic reactions such as breathing difficulty, hives, vomiting, diarrhea, and coughing. Supplements are also known as alternative medicine, and supplements do have hidden danger that we should be aware about. For example, if you compare a vitamin C pill with an orange, there's a clear difference. A pill contains vitamin C in its pure, concentrated form. So taking too much can lead to side effects. But an orange offers much more than just vitamin C. It just contains fiber, minerals, and other vitamins. Even if you eat several oranges, you will experience harmful side effects. Take Reliance as an example. Imagine that I can walk perfectly well today, but I choose to sit in a wheelchair for several years. After that time, would I still able to walk? The answer is no, because my muscle would have weakened and degenerated. The same idea applies to supplements. Over-dependence can cause the body to become reliant on them, instead of maintaining its own natural functions. Hence, the conclusion is supplement cannot be consumed daily. Next, let's have Denise to share with us more on food. Thank you.
Thank you, Cindy, for your sharing. Hi, everyone. My name is Denise. Now I'm going to move on to part 2 of today's topic, food. I have a question here. Are humans meant to eat meat or plants? Here's a clue. Take a look at our teeth structure. Does our teeth look similar or to a lion or to a horse? Let's take a look together at the teeth structure between a herbivore and a carnivore. Herbivore, a plant-eating animal like the horse, has sharp front teeth to chew the plants and grass. For a carnivore, the front and canine teeth are sharp enough to tear meat apart. How about their intestines? For example, a herbivore which is about 5 feet long would have an intestine of 60 feet long, while for a carnivore will be 15 feet. What is the reason for their difference? Plant-eating animals have longer intestines to allow enough time for absorption of nutrients, as plant foods needs time to be broken down due to large amount of fiber. Carnivores have shorter intestinal tract to allow meat to pass through quickly, as raw meat contains bacteria. Research has shown that humans evolved around 250 years ago from ape-like ancestors. So it turns out that humans are herbivores too. So it's recommended for us to eat more fruits and vegetables. When it comes to plant food, not all plant food is safe for consumptions. Plant food are categorized into 2 categories. Plant foods that are medicinal in nature comes with side effects, and overdose can lead to serious side effects as well. Many Western medicines are extracted from TCM. Aspirin, which is a painkiller which is extracted from white willow bark, can cause stomach bleeding. Digoxin, which is a drug for arrhythmia, which is extracted from digitalis, can cause heart disease. In addition, there are some plants such as Ephedra tobacco. Have you ever heard of it? Some people use marijuana to relieve pain, but they are addictive. It can be fatal if used in large amounts. Functional plant foods are wholesome foods like vegetables, fruits, and whole grains. These are foods suitable for all ages, as no matter how much you consume, there will not be any side effect. Next, I will be sharing on various nutrients in food. The first one is protein, which is essential for our body for cell renewal. So where do we get our protein from? From milk, meat, eggs, right? All these are animal proteins which are high in fats, cholesterol, animal hormones, calories, can cause the risk of osteoporosis, is difficult to digest and absorb, and children who grow up drinking milk can get allergies easily, burdens and damages the liver and kidneys. Babies need protein too. The first choice will be breast milk. Otherwise, the second choice will be soy milk, which is free of fats, cholesterol, animal hormones, and low in calories, easier to digest and absorb. It does not burden our liver and kidneys. Soy is the best source of protein. It has 2 times more protein than meat, 3 times more than eggs, and 12 times more than milk. Soy also has an anti-cancer effect, as it inhibits the growth of cancer cells and tumors. Soy helps to prevent cardiovascular diseases, which reduce cholesterol, and also prevent osteoporosis by enhancing calcium absorption and retention. It stabilizes blood sugar levels, as soy has low GI index of 18. Soy is a good choice if you want to maintain body shape, as it also helps in weight management. It helps to speed up fat decompositions and inhibit body fat formation. Next is fiber. Do you know that fiber is very important in our diet? This is because we need fiber to flush out toxins in the body. The recommended daily intake will be 20 to 35 grams, which is equivalent to 10 unpeeled apples. Insufficient fiber will cause constipation and, in the long term, colon cancer. Next, let us look at psyllium husk, which is very rich in fiber. Out of 100 grams of psyllium husk, 71 grams is soluble fiber, which is 7 times more than oats. Let us take a look at the benefits of soluble and insoluble fiber. Soluble fiber, it forms a protective layer in the intestines, blocks the absorption of fats, calories, and cholesterol, prevents cardiovascular diseases, and control weight. Insoluble fiber is a natural laxative, removing toxins from intestines, prevents constipation and cancer. Lastly, it helps to maintain a radiant skin. Phytochemicals, one of the disease-fighting nutrients. Why do we need this? This is to combat our modern diet and lifestyle. It is difficult to avoid animal protein like meat and seafood in our daily diet. As animal proteins are high in calories and cholesterol, it is not ideal for our body. Negative emotions like stress and anxiety will cause our body to secrete a toxic hormone called corticosteroids, which will suppress our immune systems up to 80% within 30 minutes. Furthermore, many food contains food chemicals like MSG, colorings, and preservatives. These will affect the normal functioning of our immune system. Therefore, it is important to incorporate phytochemicals in our diet to combat these problems. Cactus has more than 10,000 phytochemicals, which strengthen the immune system. It is a cancer fighter and neutralizes cancer-causing hormones. It is strong in anti-inflammation and prevents cardiovascular diseases. The next disease-fighting nutrient is antioxidants. Free radicals are produced in our body when we are exposed to air pollution, toxic fumes, high heat cookings, UV rays, unhealthy diet, and our body's metabolic process. These free radicals interfere with the stability of our DNA cells, causing damage, leading to cancer. Hence, we need antioxidants to destroy free radicals. Rose is rich in antioxidants to prevent DNA damage. I believe that many people want to look younger than their age, and rose has 50 times more vitamin C than lemon, which enhances the body's ability to produce collagen, which in turn also improve skin texture and lighten pigmentations. Rose also help to relieve feminine problems like period cramps, irregular menstrual cycle, and also combat colds. Cactus fruit has 7 times more antioxidants than vitamin C. It promotes cell repair and renewal, improves skin softness, aid in wound healing both inside and skin surface as well. Blueberry is also rich in antioxidants to support heart and liver health by reducing the buildup of bad cholesterol, thereby preventing cardiovascular disease and inhibits the growth of liver cancer cells by 50%. Blueberry protects brain cells and improves memory. Many people now spend long hours staring at computer screens and phones, and blueberry can help to improve vision. It also prevents urinary tract infection. The third disease-fighting nutrient is polysaccharides. Take a look at our environment. We are constantly exposed to radiation from our laptops to even TVs, and the constant virus mutation from SARS, H1N1, and now COVID. Despite the advancement of medical science, it is unable to catch up with the virus mutation. And lastly, our daily necessity products contain cancer-causing agents such as SLS and mercury. Hence, we need polysaccharides to combat these problems. Cordyceps mycelium is rich in polysaccharides. It has a powerful anti-cancer effect, regulates the immune system, which can improve both immune and autoimmune disorders. It strengthens the heart, lung, liver, and kidney functions, increase energy, vitality, and the resistance to stress. Variety of mushrooms like ABM, maitake, and shiitake mushrooms are rich in polysaccharides, which enhance the immune function and recharge immune system. The high amount of polysaccharides aids in the production of cancer-fighting cells and suppress tumor growth, preventing the reproduction, spread, and relapse of cancer cells. It also prevents viruses and harmful agents from entering delicate tissues. It also treats and prevents AIDS, chronic diseases, obesity, viral infections, poor blood circulation, stomach upset, and exhaustion. All Elite products are formulated wholesome food based on nutritional immunology, where they take further steps looking into these 6 criteria: type selection, part extraction, time of harvest, ingredients, nutrients combination, strict and advanced processing techniques, and lastly, safety tests. Cordyceps mycelium, out of the 400 species, only 10 have nutritional values. It helps to protect the lung and kidney functions, reduce phlegm, cure cough, and difficulties in swallowing. Parts extraction. In cactus, its gel is of the highest nutritional value, more than 10,000 phytochemicals, while rose is in the flower and ginseng is most nutritious in the roots. With the right extraction, it can boost immunity, prevent cancer, anti-inflammatory, aids in wound healing, and neutralize toxic hormones in the body. Thirdly, the time of harvest is also important. The plants are harvested where the nutritional value is the highest. Example, ginseng aged around 6 to 8 years have the highest level of ginsenosides, and rose is the most nutritious when it's budding. With correct harvesting, it helps the body to adapt to stressful conditions. It reduces fatigue, improves memories, improves oxygen levels in the body. Next, nutritional immunology also takes into consideration the ingredients nutrients combination, as the right combination of the ingredients can further enhance the benefits of each ingredient and bring synergy, while an incorrect combination will destroy or cancel each other out. Cactus is full of vitality where they can survive for 400 years. The right combination with cactus will accelerate the power of the body cells. Elite products goes through strict and advanced processing techniques. Example, cactus have to go through high purity infiltration to be able to filter very small particles such as bacteria that are 0.01 to 100 microns in size. Another technique will be spray drying. This method is an ideal method which requires a certain temperature to eliminate the toxins. Example will be soy, which has mild toxins. In order to remove the toxins, the skin and the seed the temperature must be at least 60 degrees. Next, with freeze drying, it can retain nutrients and maintain wholesomeness. A sliced strawberry requires 14 to 16 hours to freeze dry, while a strawberry that is non-sliced takes 3 to 4 days. Rapid freezing the plant foods at the required temperature removes most of the moisture and retaining about 1 to 4% moisture. Long shelf life without preservative and can quickly reconstitute after adding water. The last criteria is safety test. Many plants have been contaminated by the environment, soil, and water sources. And so organic does not mean safe unless it can pass the following safety tests for heavy metals, microorganisms, pesticides, and poison tests. Elite has a manufacturing facility in Singapore. It is awarded the Food Safety Excellence Award Gold by AVA, now called SFA, where it is graded A for more than 15 consecutive years. After sharing on the many benefits of food, the miracle cure is right there in the supermarkets. That is all the fruits and vegetables. Elite global products are just a convenience for everyone at all ages. Nutritional immunology advocates prevention is always better than cure. Of course, we will also need to partner with these 4 factors to achieve a healthy body. That is sufficient sleep, moderate exercise, maintain the positive emotions, and the correct, pure, and well-balanced nutrition to have a healthy body. Through our sharing, I'm sure that now you have a clearer view on the differences between medicine, supplement, food, and how to choose the correct health food, where you can share this knowledge with your families and friends. With this, I end my sharing now. Thank you, so I will pass the time back to the MC.
Thanks, Cindy and Denise, for their professional in-depth sharing. So Cindy actually showed us the side effects of medicines and supplements. Well, Denise showed us our body are designed to eat plant food and how to choose what food are superb beneficial to our immune system. Now, with all these knowledges, we can protect ourselves and our family. So, and also we can make wiser decisions to build a better health. So, our next sharer, Jasmine, will touch on her friend's father on how he recovered from a rare and life-threatening flesh-eating bacterial infection, how nutritional immunology helped and supported him in this life-threatening scenario. So without further ado, let's hear it from Jasmine.
Hello everyone, I'm Jasmine. Today I would like to share with you a father of my friend's product testimonial, how he recovered from a critical bacterial infection. So back in October 2023, my friend's father suddenly fell seriously ill and lost his voice. Initially, uncle was given an injection and medication by the doctor, but his condition worsened the next day. So he experienced breathlessness, couldn't eat, and was sweating profusely. His family then quickly rushed him to the E&E that night. Doctors then diagnosed him that his C-reactive protein, which is the CRP level, a marker of inflammation, was very high, while the normal CRP range is below 5. However, his CRP level has spiked up to 360 milligrams per liter. He was then admitted to the ICU immediately. Despite being placed on strong antibiotics, the bacterial infection couldn't be controlled, and his CRP rose further to 570 milligrams per liter. Okay, so let me share my screen here. Yeah. So over here, you can see the CRP level has spiked to 576.2 milligrams per liter. So initially, doctors suspected he might be infected with pneumonia. A CT scan later revealed that he was not suffering from pneumonia, but from a very rare flesh-eating bacterial infection. The infection had begun at his neck and spread over to his lungs and even his heart, filling them with pus. So this type of infection is extremely rare and typically requires 3 to 4 surgeries with a risk of surgery at 50%. The surgeries involve opening both sides of his neck, performing keyhole procedures on both lungs, and creating a hole in his throat for breathing support. So in total, there were 10 incisions were made on his body. So even so, the infection remained uncontrolled. His condition was very serious. He then developed heart failure, also experienced irregular heartbeat, extremely high BP, and high blood sugar levels, despite not being diabetic. Hence, he also required insulin injections. During this period, he fully relied on the oxygen support and ran a fever every single day. So doctors then warned the family that his immune system was too weak, giving him only a 20% chance of survival. As a last resort, a 5-day immunoglobulin treatment was administered. And at that point in time, his family also supported him with nutritional immunology products. He began taking cactus and American ginseng daily, and by the 3rd day of treatment, his fever subsided. So his CRP level also gradually decreased. His condition started to improve, and after 2 weeks, the oxygen tube was removed, and miraculously, the hole in his throat, which would normally take weeks to close, healed within days, and his neck wound also healed so well that stitches were unseen. Because of his many years of consistent health maintenance, his kidney function remained strong enough for him to endure 2 major surgeries and aggressive medication. So eventually, his CRP level also dropped back to the normal range, which is 3.2 milligram per liter. Okay, let me share my screen here. Can show you. Yeah, so over here you can see it dropped back to 3.2 milligram per liter. Yeah, which is a very good recovery, I would say. Okay. Yeah. So doctor also mentioned that such a serious infection could have claimed his life within 3 to 4 days. And even if he had survived, right, 2 to 3 months of hospitalization would have been expected. And however, after 33 days of hospitalization, including 27 days in the ICU and 6 days in the general ward, he was discharged. And after discharge, he continued tube feeding alongside cactus, American ginseng, cactus fruit, Acerola cherry, cranberry, rose, soy, and banana. All these precious ingredients. So follow-up medical reviews showed a remarkable recovery in his lungs. He was once a smoker for 60 years. He has since quit completely, and now his heart function test even showed a result above 80% of the healthy range, an outcome better than what many people in their 50s or 60s might achieve. Though he lost 11 kilograms during his illness journey, he now looks radiant and healthy. So over here, I can share a picture with all of you. Wait a moment. Yeah. So over here, you can see, it is really such a amazing recovery journey, I would say. And his blood sugars also stabilized. Insulin was no longer required, and his overall medication was reduced. Life has since returned to normal, and he has even continued cooking for his family, just as he always loved to do. So I shall end my sharing here. Thank you.
Thank you, Justin, for sharing this testimonial. May I know, just now you mentioned those precious ingredients, right? How can we get access to all those things that you mentioned?
Yeah, hello MC. The ingredients that I mentioned earlier can be found in Elite products. Let me share my screen. So they are Rhapsody, Rositime, and Phytofit. So my friend's father began taking, let me use the laser pointer, began taking 1 carton of Rhapsody daily. And by the 3rd day of treatment, his intake was then increased to 2 cartons of Rhapsody per day. And after being discharged from the hospital, he continued to consume Rhapsody, Rositime, and also Phytofit. Yeah, and it is really a blessing to have known the nutritional immunology knowledge and elite wholesome products for the family and gain back his health. Thank you so much.
So thank Jasmine for her sharing, and also congratulations to Uncle for really regaining back his health, and yeah, because it is a life-threatening scenario, and to be frank, not many people walk away from this. Yeah, so I'm glad via nutritionology and via elite products, right, Uncle has managed to be healthier than even before, right? Now, I'd like to bring a disclaimer to your attention. So elite products are plant-based food which are very beneficial for health maintenance. However, elite does not advocate any form of self-diagnosis or medical treatment. Now, if you have any medical condition, please seek professional medical help. Thank you. So with this, we have come to another next segment, which is also my favorite segment, the Q&A segment, whereby I'm sure that you heard a lot through the past presentation, and probably a lot of things go through your mind, and there probably are some questions that you'd like to find out a bit more. Right now, this is a time for you to do that. So if you have any questions regarding today's presentation, you can actually raise your question to the chat box, or you can actually unmute your mic and voice out your question if you do have any. All right. And because due to time constraint, every individual is only allowed to ask one question. So just now we see the chat, a lot of activities there. It's good because the activity means that you are listening to the presentation and you interact with us, right? That's the right way to do that. Yeah. So let me see. Let me see. Okay. Okay. With that, actually I saw there's a question in the chat box. Okay, the question goes like this: there are many health food in the market. How do we choose wisely? This is a very, very good question, I would say, because there is really a lot of health food in the market, and choosing them can be very challenging. So yeah, so anybody from the health and Q&A team, right, would like to address this question?
Hi, MC. I'm Daniel here. Maybe I can help to answer this question. This is definitely a good question. So there are many health food in the market. So how do we choose wisely? So from the nutritional immunology perspective, here's how to choose wisely. Maybe I can share with you a few slides. Please give me a second. So I hope everyone can see my slides. So there are 6 criteria in choosing a health food. So first of all, it's a plant food as opposed to animal-based food. This is because animal-based products are high in fat, high in cholesterol, calories, and contains the animal hormones. So research shows that animal-based products may lead to cancer, cardiovascular disease, which is a heart disease, diabetes, and actually increase the risk of strokes. However, not all plant foods is safe to consume. So for example, plant foods are actually divided into 3 categories, which is poisonous, medicine, and food. So poisonous, these plants can be deadly, while some can only be applied externally. Medicine, some medicinal plants cannot be consumed by pregnant ladies and children. Food, plant food, which can be consumed at any amount without any risk and side effect. Thus, the second criteria is choose the wholesome plant food. This is because wholesome plant food contains a variety of complete plant food rich in phytochemicals, antioxidants, polysaccharides, vitamins, and minerals that work together to support our immune system. So for example, eating the whole orange is better than just taking the vitamin C pill. An orange has more than 100 types of phytochemical, and if we eat the whole orange, not only obtain the whole nutrition of the orange, and if we consume too much, will not have any side effect. On the other hand, the extracted vitamin C's have to undergo many chemical refining methods, and they are very pure. Excessive consumption can cause side effects such as nausea, diarrhea, heartburn, headache, and even kidney stones and cancer. And scientists have not yet understood all the nutrients of whole oranges. So nature is always better than the artificial one, and there are no side effects. So third criteria, choose a plant food that rich in phytochemicals, antioxidants, and polysaccharides. The more phytochemicals, the better for our immune system and help to prevent diseases and speed up the wound healing process. Antioxidants that help to fight free radicals and help to keep human organ young. And polysaccharides actually come from the mushroom that help to inhibit the tumor growth and help balance the immune system. And fourth criteria, many varieties and sufficient quantities. The human body has 80 trillion of cells and the various systems, which have 9 various systems in our immune system that require many varieties and sufficient quantities of nutrients. So according to study, if we ate up to 10 portions of fruits and vegetables a day, there will be lower risk of diseases across the board, from heart disease, diabetes to cancer and stroke. Fifth criteria, it must pass the safety test and with a standard compliance. So the immune system relies on the safe and uncontaminated plant food as a source of nutrients to maintain our health. However, environmental pollution such as soil degradation, pesticide, heavy metal, contaminated water can compromise the quality and safety of this plant. Thus, even if it's organic, it doesn't mean that it's safe to consume, unless it passes the following stringent tests, which is the heavy metal test, microorganism test, pesticide test, as well as harmful chemical test. And last but not least, it does not interfere with the body repair ability and defense of diseases. So the body already has its own repair and defense system. Some weight loss tea on the market may contain stimulants that can suppress our appetite, boost our metabolism, and act as a diuretic to produce the weight loss effect. Hence, it's not suitable for consumption because stimulants can impair our ability to defend against the diseases. Hence, a healthy food must support the immune system's natural ability to repair and defend, instead of creating an extra burden to our body. Only then it can help us to stay healthy, useful, and resilient against diseases. My sharings end here. Hope that I've answered your question. Thank you.
Thanks, Daniel, for helping to answer this question wonderfully. Because now with Daniel sharing, now you know, right? Even no doubt there's a lot of health food, but with no scared because Daniel has shared with us, as long as we fulfill these 6 criteria, okay, as long as we fulfill the 6, you can actually eat them wholeheartedly. So make sure that you stick to these 6 criteria for choosing a health food. Right. So with this, we probably have come to almost the end of tonight's webinar. But hold on. Okay, before that, okay, I'm gonna bring you a very wonderful announcement. As you probably may know, okay, Elite Global, right? Okay, is actually next year we are celebrating Elite Global 10-year anniversary. So 10-year means it's a milestone in the making. So and Elite, right, not only bring us wonderful science on nutrition, immunology, and amazing products based on the testimonial you heard. Elite also bring us to incentive trip every year, free incentive trip. So for this 10-year anniversary, where are we going? Let's watch a video to find out.